Stage 3 is a pivotal and exciting milestone. Voluntary movement is starting to return, but spasticity is at its peak. This means you're going to be experiencing a lot of stiffness in your affected limbs, and this makes coordination challenging and progress difficult. But there are ways to break through this spasticity and continue progressing, and in this video, I'm going to be showing you what the goals in the evidence-based interventions are to help you build strength, overcome spasticity, and regain your independence. Welcome to Indie Neurotherapy. My name is Evan. I am an occupational therapist and I specialize in neurorehabilitation. And this channel is all about helping stroke survivors continue their recoveries at home. So if you don't know what stage you're in, be sure to check out our self-assessment video where I'll take you through and help you figure out what stage of stroke recovery you're in, and that way you can find the right videos for you. Now let's get back to the video. In stage 3, your affected limb is starting to show voluntary movement, but your brain is still working very hard how to relearn how to control these movements. Even though the spasticity and stiffness you feel in your limb may feel like a setback, it's actually a positive sign. It's a sign that your brain is starting to reconnect to your affected limbs. So what should you focus on in stage 3? Well, our goals in stage 3 shift to these 3 main areas. The first goal is to manage your spasticity and maintain full range of motion in your affected limbs. The second, you want to advance your neuroplasticity exercises to continue rewiring your brain. And the third goal is to start using your affected limb in everyday life activities. Now let's break this down step by step, starting with spasticity. Spasticity is frustrating, it's uncomfortable, and it can be painful for some. But remember, it's a positive sign that your brain is reconnecting to your limbs. If left unchecked, spasticity can cause muscle shortening, which can lead to permanent contractures. So managing your spasticity daily is essential for preventing these complications and preparing your body for neuroplasticity exercises. So let's get into how you can manage your spasticity daily. Hand orthotics can now be used. Hand orthotics passively position your wrist, hand, and fingers in a safe position that prevents contractures and stretches really tight hands. Be sure to ask your therapist or doctor if a hand orthotic is right for you in managing your spasticity. Next up is limb positioning, and positioning may matter a lot more than you might think. Neutral positioning with pillows can help prevent joint and muscle contractures, but watch out for common mistakes like resting your arm across your chest or leaving your ankles unsupported when lying down. Small adjustments here can make a big impact. Stretching is another key piece. It helps to elongate stiff muscle tissue and prevents against contractures from forming. Even just a few minutes of gentle stretching each day can help keep your muscles and joints moving in the right direction. Passive range of motion exercises are invaluable. If someone can assist you, have them gently move your arm or leg through its natural range of motion to reduce swelling and stiffness. If you don't have help, self-range of motion is a great alternative. But consistency is key here. This needs to be done on a daily practice to make a real difference. Pharmaceutical interventions can be used with individuals with severe spasticity. Talk with your doctor to see if medications like baclofen or Botox injections may provide some relief with your spasticity. These treatments are best used when they're combined with traditional spasticity managing strategies. Managing spasticity is a central focus in stage 3 of stroke recovery. While it's frustrating, just remember it's a normal part of the process. Now, let's get on to our neuroplasticity exercises you can do in stage 3 to continue rewiring your brain. First up is electrical stimulation, and there are 2 different types of electrical stimulation that we may consider using. Neuromuscular electrical stimulation is passive, and it helps to manage spasticity while reducing issues like shoulder subluxations or foot drop. But functional electrical stimulation takes it one step further by actively engaging those muscles during real-life tasks, such as pushing up to stand or grabbing onto something. However, electrical stimulation is not for everyone. Be sure to check with your therapist or doctor to make sure that you don't have any contraindications that would make it unsafe for you to use this intervention. Next up, we have weight-bearing exercises. These exercises activate affected muscles to encourage neuroplasticity. Just start small with some simple tabletop exercises to build strength and motor control. And as you progress, you can gradually add more challenging movements. Next up is strengthening exercises. With voluntary movement returning, it's now time to start building strength. Early strengthening exercises like isometric contractions and light resistance exercises using bands or weights are great for reactivating affected muscles and improving the strength and control in these limbs. Bilateral arm training is next, and this is using both sides of your body to improve coordination and reinforce your neural pathways. Try holding on to a staff to practice gross motor tasks, or use an arm or leg bike to keep both sides engaged and working in harmony. Up next is repetitive task training, and repetition is a very powerful way to strengthen neural connections. Simple tasks like sliding your hand across the table or practicing grasping objects are highly effective for reinforcing motor learning. Just remember that small, consistent efforts add up to big progress. Next up is sitting balance retraining. Sitting unsupported at the edge of the bed works on postural control of your core muscles, and it helps to reestablish and rebuild equilibrium deficits that some stroke survivors experience. If you have trouble sitting, have a family or caregiver spot you, and find a place for arm support on your unaffected side. As it gets easier to sit independently, you can start sitting up for meals and for self-care activities like dressing. Up next is gross motor coordination exercises. Gross motor coordination focuses on using larger muscle movements. Exercises that rebuild motor control, like step-ups, weight shifts, or practicing reaching with a sable glove, are essential for restoring this foundational skill. Another great intervention for stage 3 stroke survivors is seated yoga or Tai Chi. Adapted yoga or Tai Chi while in a seated position helps to reduce spasticity while improving coordination and postural control. If you struggle to sit independently, just have someone sit nearby to support you as you work through these movements. Mental imagery and action observation stimulate the brain even without any physical movement. Mental imagery involves visualizing yourself performing a specific task, while action observation involves watching someone else perform it. Both are powerful tools for rewiring your brain. Sensory retraining involves helping your brain reconnect with the sensations of your limbs, and this will help improve the use of those limbs. It involves some simple activities like feeling different textures or temperatures, and it can even involve sensory electrical stimulation, which helps to reawaken those sensory pathways. Mirror therapy is up next, and this involves using a mirror to reflect your unaffected limb. This creates the illusion that both limbs are moving normally, and this is just another intervention to stimulate neuroplasticity even if no movement is possible. And now that we've laid the foundation for your recovery, the next step is task-specific training. All this is using your affected limb in everyday life tasks. The whole point of your stroke recovery is to regain functional use of your affected limbs, and in stage 3, you can start to do that. In stage 3 stroke recovery, task-specific training may look something like this. You could be kicking a ball or tapping a balloon with a friend or family, or you may even start things like combing your hair or brushing your teeth. These tasks may seem basic, but the key is how you do them. We want to focus on intentional movements and proper form. Just remember that every repetition you do brings you closer to more controlled and smoother movements with that task. Task-specific training is more than just movement. It's about using your affected limbs in meaningful everyday tasks. This repetitive and purposeful practice taps into your brain's natural ability to adapt and rewire itself, creating stronger neural connections. With consistent effort, even small changes in your daily routine can lead to big impacts in your recovery. If you're ready for the next step in your stroke recovery journey, then check out our Stage 3 exercise video playlist, where we'll go through some of the evidence-based interventions that we talked about today. Are you a stroke survivor who feels stuck, overwhelmed, or frustrated with your lack of progress? Maybe therapy has ended, now you're on your own, and you're just a little unsure about how to continue progressing? Well, if this sounds familiar, my one-on-one coaching program is for you. At indieneurotherapy.com/coaching, I offer a recovery plan tailored to your goals and physical abilities. You'll get personalized home exercises as well as access to a stroke recovery specialist, me. And together, we'll cut through all the trial and error and help you focus on what really works, helping you make real progress. But spots are limited, so don't wait. Visit indieneurotherapy.com/coaching and we'll explore if it's right for you. If you found this video helpful, the best free thing you can do is give me a like or comment on the video. And if you're looking for more information on stroke recovery or guided exercise videos, be sure to subscribe. Thank you so much for watching and have a wonderful day.